If we combine pre-hypertension, the problem is much, much, much bigger. And most of the people who have hypertension, they have either pre-hypertension or mild hypertension. They are, all of you know it's an important risk factor for stroke, myocardial infarction, heart failure, and renal failure. In spite of very effective drugs, you heard since morning, and also lifestyle, which we know a lot, BP is not controlled in majority. You heard from Dr. Prabhakar. In India, it is less than 10% in the rural population. Uncontrolled hypertension is a major cause of stroke. 62% of strokes occur because of this, and about half the ischemic heart disease occurs. So there's a need for some new novel technique which is non-invasive, non-pharmacological. People don't take drugs because of so many things. They are asymptomatic, their side effects are costly, and so on and so forth. Reasons are many, and therefore there's a need for some. And yoga may be such a technique. I will try to show you how it can be, especially when stress may be having a role in the causation of hypertension. Stress is not still considered as important factor, but I think it's one of the most important factors. You all know stress increases blood pressure acutely, both in experimental animals as well as in human beings. You have seen the 9/11 tragedy, wherever the earthquakes occur, the people around these areas, they get high blood pressure, which remains for several weeks. And if this occurs again and again, possibly it can cause hypertension. Repeated stress, which causes repeated increase in blood pressure, may damage the blood vessels, and therefore the endothelium may be damaged and peripheral vascularization is increased, which can cause hypertension. Experimental animals have been shown to develop hypertension with chronic stress. There are several studies available, and there are studies available that people who have work stress, sleep deprivation, rumination, that means past angry thoughts, and noise pollution have higher blood pressure. This is very well known in several epidemiological studies. Even Dr. Pickering had suggested this in his textbooks and several articles. Meditating nuns, on the other hand, who have very little stress, they have low blood pressure. And there are several conditions in which we believe that stress is a factor. For example, early hypertension, the heart rate is increased and the blood pressure is increased, and we try to give beta blockers. And white coat hypertension, many of these people possibly have this stress. Now, the pathophysiology of stress has been studied. Earlier it was thought it causes only psychological diseases, for example, anxiety, etc. But now it has been shown that the psychosocial stress, which can be caused by job stress or emotional stress, like especially depression, a lot of factors, a lot of importance is being given to depression, because recently the American Heart Association suggested that depression could be considered as one of the major risk factors, like smoking and all. So all these factors ultimately have a lot of physiological mechanisms, which you heard a lot from the physiologists. They disturb the autonomic nervous system, increase the sympathetic, decrease the parasympathetic, disturb the hypophysis pituitary adrenal axis. They cause oxidative stress, they cause inflammation, they cause a lot of neuroendocrine changes, including rise in the angiotensin system and coagulation factors, as a result of which lots of disease can be caused, which have been shown in animals as well as in some human beings. Hypertension can be caused, diabetes mellitus, obesity, even coronary artery disease, dyslipidemia, obesity can also be caused. Central obesity has been shown to be caused by stress because of all these alterations in the neurohumoral factors. Endothelial dysfunction can occur, atherosclerosis, ischemia, ultimately death can occur. And yoga can, everybody knows, can take care of this stress, and therefore it could be a useful technique. Now, what is yoga? Yoga is not a few postures, but a complete way of life. Everybody has heard about yoga because of this international discipline now. It's a practical universal discipline irrespective of culture, age, and it can be done by anybody. It aims at harmonious development of body, mind, leading to physical well-being, mental harmony, culminating into positive thinking, happiness, and peace. A better term is a yoga lifestyle, which consists of 4 factors. This is what yoga is. This has been ignored in many of the publications also, because I think some of the Westerns are not aware what yoga is. Yoga lifestyle has 4 factors. It's physical well-being, which consists of a diet, which is sattvic diet, a diet which we give for hypertension patients or coronary artery disease or diabetic. Physical exercise is a part of yoga, and no addiction, no alcohol and no tobacco is a part of yoga. Mental well-being is a very important part, which can be achieved by stress management, meditation. Numerous studies are available. I'll not go into detail. Emotional well-being, you just now heard, anger, ego, jealousy, hostility, they can all cause diseases, including hypertension and coronary artery disease and even diabetes. And the positive emotions like that you have to have mental relaxation. Now, people have used any one of them for treatment, for the management of hypertension, either all these three factors or one of them. Breathing has been used alone. Even left nostril breathing has been shown to decrease blood pressure within 5 minutes because it increases sympathetic activity. There are a lot of studies on meditation and some studies on all the three components. Therefore, what is yoga is not anything new, but it's a lifestyle. It's a holistic and intensive lifestyle modification consisting of stress management, that is the most important part, healthy diet, regular exercise, and avoidance of tobacco. I like to call it a lifestyle polypill. And you can see that this lifestyle polypill should be able to control all these so-called lifestyle-related diseases. And the data is already available that it is able to control many of these so-called non-communicable diseases. It has been shown to control anxiety, depression as good as medicines without any side effects, mental peace and happiness, bronchial asthma, some studies, physical fitness, irritable bowel, joint pains, cardiovascular diseases. There are data on diabetes and other things also, but I will talk about the cardiovascular disease, especially hypertension. Now, as you heard, cardiovascular disease is a continuum, starting with some risk factors like hypertension, dyslipidemia, diabetes, obesity, and so on. And that causes oxidative stress and inflammation and neurohormonal changes. All of them can be affected by yoga. There are studies available in each one of them. I'll not go into details except hypertension. Then it causes atherosclerosis, and there are studies to show, which we have also participated. Early and advanced atherosclerosis can be reduced, ischemia can be reduced, even myocardial infarction can be reduced, secondary infection, there's one study, and it can control several arrhythmias, which are complications including ventricular and atrial fibrillation, and even congestive heart failure. So it seems that yoga affects at every system, every part, and as you heard, hypertension is not alone. Actually, it occurs with so many other diseases like dyslipidemia, obesity, diabetes, and so on. And yoga seems to be a single pill which can affect all this, and I'll show you data. Now, what about yoga and hypertension? That's my main topic. Well, there are several randomized and non-randomized studies are available, but the history started in India itself. Dr. Tate from Bombay reported one series in which he said Shavasana. Shavasana is a person lying down like a corpse posture, it's called, and it reduces blood pressure significantly, 18/7, and as much as 30/20 also in some of the patients. This was not accepted because non-randomized studies was there. Similarly, Dr. Benson from United States Harvard Medical School, transcendental meditation was started by Maharishi Mahesh Yogi. He reported similar things, that the blood pressure can be reduced by 10/5. People did not attach too much importance because they said non-randomized studies and all, but it was clearly shown that these postures, just these two postures, one is meditation, the other is just a corpse posture, which is a method of lying completely peacefully. Then subsequently, large number of randomized studies and meta-analysis are available. The interest is so much that in the last 2 years, about 8 meta-analyses have appeared, showing that the interest in hypertension is there. I will talk some of these meta-analysis. I think this is one of the best meta-analysis done on transcendental meditation, which has taken into consideration American Heart also Association, I'll talk, and they have also suggested this could be a good method. This was a meta-analysis of 9 extremely well-planned studies in 711 patients. They were mild hypertension or pre-hypertension, and they showed that the systolic blood pressure did decrease by about 5 millimeters and the diastolic by 4. So there was a consistent, although very modest. It may look very small, but I may tell you in the population, just 5 millimeter systolic pressure, 3 millimeter systolic blood pressure decrease can decrease stroke by 8% and coronary arteries by 5%. And 2 millimeter diastolic, can be as useful as treating all patients of hypertension. It's been shown long back. Another meta-analysis, systemic review, which was done in about 6 randomized studies and all. Again, there was a tendency in most of the studies to show lowering of the systolic and diastolic. This is one of the best meta-analysis in which these people analyzed about 700 studies, and this found that only 22 met the criteria of the inclusion. And this is what they found in these 22 studies, that in practically most of the studies, the systolic blood pressure decreased markedly. In some of them as much as 20 millimeters, but average was about 5 millimeter. So there was a definite, some studies of course did not show, as you saw on the bottom, but most of the studies did show, and there was a statistically significant 5 millimeter decrease. The studies which showed marked decrease in blood pressure as much as 20 millimeters, these were the studies which included all the three components of yoga. I said there are three components. One are the stretching exercises called the asanas, the breathing exercise, and meditation. And some of these studies only included meditation, some only included
Sir,
breathing.
2 minutes more.
Okay, I'll just finish it. The diastolic was also reduced by about 3 millimeters, and this is one of the largest meta-analysis, again done in about 100 cases, both randomized, non-randomized, similar. And American Heart Association, after reviewing all these data, they have brought out this article in which they suggest that transcendental meditation has a modest effect, and it should be used in every patient who has a blood pressure of 120/80 or more. This is accepted by them also. There are other benefits of yoga which are extremely useful for hypertension, inflammation, oxidative stress, improvement of endothelial function, obesity, smoking, alcohol control, better sleep. There is even preliminary data to show that even obstructive sleep apnea may be decreased, LVH, atherosclerosis, and so on. I'll just show you some of the studies. The LVH can be reduced by, this is transcendental meditation, insulin resistance and metabolic syndrome, anxiety can be decreased, similarly the depression, cigarette smoking can come down, alcohol use can be decreased significantly, and this is a study we did in metabolic syndrome, and we found that the early atherosclerosis, carotid intermittent medial thickness significantly decreased after 1 year of training, and all the biochemical parameters like blood pressure, the central obesity, and the lipids also significantly decreased. Advanced atherosclerosis, also there are 3 studies. Each one of them shows that the obesity is reduced, lipids are reduced, angina is reduced, regression is there on angiography, psychosocial stress, and the compliance is most important. It is said that difficult to follow lifestyles, but I think once we make people do yoga, the compliance improves markedly because the mind becomes strong. I asked my patient, why don't you exercise? I said, I get up in the morning, my mind says, don't go today. You had a late night and it's raining, some excuse. But those people who do yoga, the compliance is better. This is a study on outcome study, secondary prevention, 7 years follow with transcendental meditation, randomized study, and it shows a 48% decrease in repeat myocardial infarction and death by transcendental meditation. So even outcome studies are available, and this is a study in our favorite journal, JACC, which shows that arrhythmia, atrial fibrillation can be significantly reduced by 8 weeks. Heart failure also there are studies, ejection fraction is improved, quality of life is improved. Small studies, I agree, and this is the mechanism which has been proposed. How does yoga improve hypertension? There are 2 pathways. One is by decreasing stress and sympathetic system and decreasing the HPA system. It causes large number of neurohormonal changes. On the other side, vagal stimulation, you just now heard, improves the heart rate variability. There are four articles on heart rate variability, inflammatory cytokines, baroreceptor sensitivity is changed in hypertension, and that's the reason why it is, and heart rate variability. All these act with each other. They decrease the oxidative stress, endothelial function, and that's how they decrease hypertension, atherosclerosis, arrhythmias, heart failure, and even diabetes and all. So to conclude, as I said, hypertension is a big challenge. It's not controlled in majority. So we need something new, and several randomized studies have shown that yoga could decrease blood pressure as well as mental stress by decreasing mental stress. Mechanism has been studied by stabilizing possibly the autonomic nervous system, resetting the baroreceptors, neurohumoral factors, anti-inflammatory effects. The reported studies have, of course, several limitations. These are small studies, and the methodologies are really not very, very adequate. Therefore, larger trials are. However, yoga being a simple, safe, and cost-effective technique with several benefits on cardiovascular system, it is being used for prevention of cardiovascular disease. It should be used, as the American Heart Association says, for management of early hypertension, pre-hypertension, either alone or as a complementary technique. And because now yoga has become an international discipline because of International Day of Yoga, which is celebrated all over the world all over is doing, and this may be one of the good methods to implement in the community, as you heard. And I would suggest to Dr. Rajan, he has spoken very well. We have large number of these spiritual masters who have huge camps. Blood pressure can be checked with them. And you can also study the effect of meditation, etc. Huge studies are already going on because these people like Ramdev, Shri Ravi Shankar, and Dr. Nagendra, who will be coming in the evening. They have millions of people, their followers, and they run camps and all. So blood pressure could be easily detected and also could be easily controlled by a holistic lifestyle, which is called yoga. Thank you very much.
Thank you very much, Dr. Manchinda. One question, important question. Yes, sir. Mike?
You see, to start with, I have been involved in it is about 1 hour a day to learn it. Once you learn it, it can be done 24 hours in a day. Sitting in a car, you can do meditation. After all, what is meditation? That you have to concentrate and think positive. Concentrate one thing at a time and think positive. That's all. Ultimately, it becomes a habit. We call it a meditative attitude. My patients ask me, how long should I do? I said 24 hours in a day. While you are working, you are concentrating. You are doing, I am doing angioplasty, fully concentrating. If something goes wrong, artery ruptures, I think positive. Similarly, when you are walking, you should do it. So it becomes an attitude. To learn it, it takes a few months.
One more question. No comments. Thank you, Dr. Manchinda. But before you go, I would like to know, even massage has found to enhance interleukin 10. Do you have any information whether yoga can enhance interleukin 10? Thank you.
Yes, there are studies available on that. I said inflammatory markers have been all mentioned. There are studies, 3 studies available.
Thank you very much.
Thank you. Okay. Thank you. Now, I would like to invite Dr. Arvind Jagdish. He is a chairman of Dr. Arvind's Diabetic Center in Bangalore, and he'll be talking about is there a legacy effect of BP lowering hypertension, which is similar to a glucose lowering effect in the diabetes.
Yeah. He's giving you. Good morning, everybody. It's always a pleasure to come to Hyderabad, which is a city of biryani. We always relish these dum biryanis all over India, all over the world as well. So, Dr. Banshi has already given me a warning. So we know T20 is very famous in our country because of IPL. Now 20 minutes is becoming very popular in our conferences as well. So that's what Dr. Banshi told me before starting, Arvind 20 minutes. So I'll try to keep up this to my best of this one. So today's my topic is there a legacy effect of BP lowering in hypertensive diabetic patients? As we all know, there is a legacy effect in type 2 diabetes patients, in the sense, if you treat very well in the initial stages of diabetes, the metabolic effect, that means long-term memory effect, that is the legacy effect, plays a very important role in preventing micro as well as macrovascular complication in 10 to 15 years down the lane. Is this applicable to hypertensive patient as well? This is the topic of discussion today. So first of all, greetings from Bangalore. Andariku Namaskaralu. So we'll kickstart this discussion. So we have to leave a legacy which is worth sharing. So if you take the 2 diabetic patients out of 3 also suffer from hypertension, worldwide epidemiology shows 1 billion hypertensive patients, 415 million patients with type 2 diabetes, 277 million hypertensive patients with type 2 diabetes. Excess cardiovascular risk in diabetic patient is attributed to coexisting hypertension. That is all-cause mortality 72%, cardiovascular disease even 57%. Means participants with hypertension at the time of diagnosis, of diabetes diagnosis, had higher rates of all-cause mortality and cardiovascular disease than did people with diabetes without hypertension. So if you see, blood pressure is uncontrolled in most of the diabetes. This chart shows more than 85% of the patients had more than blood pressure 140/90. Only 15% had blood pressure of less than 140/90, and very meager amount of less than 3% had blood pressure of 130/80. A randomized trial of 6 monotherapies, if you see this chart, it shows a single drug will control only about 50% of the patient's blood pressure at the best. Means, if you say hydrochlorothiazide, atenolol, captopril, clonidine, all these molecules will control blood pressure only up to 50%. It needs a add-on medications. If you add a second drug, you see this in Hallott study, which involved 33,000 patients. Moment you add a second add-on drug, the percentage of blood pressure will increase, like 41%, 40%, and 43%. So which is better, stepwise addition or starting with a fixed dose combination? In one of the study, that is accelerate study, 1,200 patients were randomized to receive 2 drugs using stepwise monotherapy strategy, the same two drugs as a fixed dose combination. If you see this chart, it shows fixed dose combination started early in the disease management. They have got a better blood pressure control in week 8, 16, as well as 32 weeks, rather than going in a stepwise